Hello, I'm Dr. Lonnie McMichael. I'm a senior instructor in professional and technical writing at UCCS, and I'm the author of 2 books, Talking Fat and Acceptable Prejudice, Fat Rhetoric and Social Justice. Today I'm going to talk to you about healthism and how that has been used to vilify fat people. This is a fat studies presentation in the area of rhetoric. Yes, I'm going to use that forbidden word fat instead of obese. I'll explain why later. So what is healthism? Robert Crawford coined the word healthism, arguing that healthism elevates the idea of health to superior value. In other words, we place a moral value on actions, food, or people that we perceive are healthy or unhealthy. Healthism shows up in a number of places, but we often see it with issues that are perceived to be controllable, such as alcoholism, addiction, smoking, and fat. These concerns often become what Stanley Cohen calls a moral panic. A moral panic is when a condition, episode, person, or group of persons emerges to become defined as a threat to the societal values and interests. In moral panics, someone in power starts proclaiming that an issue or set of people are a threat to the society's well-being. Politicians and the media reinforce the idea by speaking about it in provoking terms. In return, the populace demands a response. Since Crawford defined healthism, we have seen it on the rise for many reasons. We can trace some of these reasons when we look at the realm of fat and the obesity epidemic moral panic. In 1997, William Dietz, the director of the Division for Nutritional and Physical Activity in the CDC, was the first to proclaim obesity as an epidemic, a word with connotations making fat about public health, according to Mitchell and Mateague. After that time, we see healthism in regards to body size showing up as a replacement for other prejudices, as a scapegoat for our rising costs of healthcare, and because the medical pharmaceutical complex has discovered a good healthist campaign can create big profits. We can see that healthism has been used in some cases as a replacement for other prejudices. Most importantly, legally, you cannot discriminate based on sex, race, or age. However, you can discriminate based on body size in all but a few places in the United States. Therefore, fat is often used as an excuse to practice other forms of discrimination. For instance, white men are much less likely to experience negative effects from a large body, where women and people of color experience more negative effects. Men have lower levels of mistreatment by strangers. In fact, men are seldom affected by weight bias until they reach a BMI of 35, well into the obese category. People of color are affected. Wong et al. Says that fat people of color experience more prejudice in healthcare. Discrimination based on body size becomes evident when we look at women. Women start experiencing negative effects from a body size of a 27 BMI, significantly lower than men. Zagorski found that women's wealth could be significantly affected by body size. Feminist scholar Catherine Manton argues that as women have gained rights, their bodies have been more and more controlled. Women gained the right to vote in 1920, and shortly thereafter the flapper body style, boyishly slim physique, and lacking breasts came into fashion. As women started gaining rights in the 1960s, the Twiggy style, a slim, boyish look, came in. From that time on, in fact, we see the inverse correlation in that as women gained autonomy and power, the accepted body size became smaller and smaller. Both Manton and author Naomi Wolf, another feminist scholar, argue that such restrictions on body size are used to control women. Wolf says, dieting is the most potent political sedative in women's history. A quietly mad population is a tractable one. The current political climate reveals just how fat has been used to practice illegal discrimination. Now that racism and sexism are on the rise again, thanks to their acceptance by those currently in power, fat is getting less attention. When racism and sexism again become unacceptable, which will happen, fat is likely to rise again as a replacement. Another reason we see healthism on the rise is that our medical costs are skyrocketing. Numerous studies have been released showing how fat people cost more in terms of medicine. These studies are often problematic in how they determine their numbers. Additionally, these statistics often contain the costs of trying to reduce fat, including the costs of bariatric surgery and diet programs, as well as the more insidious costs of medical fat prejudice, such as ordering unneeded tests. As Regan Chastain, professional dancer and fat person, says, "Let's remember that costs of obesity are not the same as costs of obesity hysteria." By convincing us that fat people are costing us too much, the medical pharmaceutical complex shifted the blame for rising healthcare to a vulnerable population with little power to fight back. Lately, there appears to be a slight reduction in the focus on the idea that these evil fat people are costing everyone. This may be because, as a society, we have begun to recognize corporate greed and how that plays a significant part in our rising medical costs. Third reason is profit. To frame the situation, we must understand the whole obesity epidemic has been one of the healthist campaigns culminating in a moral panic. According to Campos et al., we have gotten a bit heavier, about 6 to 5 to 11 pounds since the last generation. We have also grown about an inch taller. For the last couple of decades, the baby boomers have been moving through their 50s and 60s. We know that the human body tends to gain some weight in this time period as a protection against catastrophic disease. As the baby boomers age out of that range, we actually might see this number drop a bit. One of the primary reasons for the obesity epidemic, however, was that literally overnight, 32 million people went from either normal to overweight or from overweight to obese. That happens when you redefine obesity, as was done by the AMA on June 16, 1998. Now the medical establishment could rightfully claim that there was a dramatic rise in the incidence of overweight and obese people. And they often phrase it that way in the medical literature. The medical establishment's use of the words overweight and obese is why I use the term fat. Overweight and obese are medical terms with arbitrarily shifting definitions that the medical establishment used to label people as diseased, the AMA having defined obesity as a disease in 2013. Fat is just a descriptor, like tall or blonde, associating it with greedy, lazy, smelly, gluttonous, and the like. Fat study scholars are choosing to reclaim the word, stripping it of its negative connotations. Why did our medical establishment create this obesity epidemic? Trying to make fat people thin is a big moneymaker. In fact, according to Market Data Enterprises, the diet industry made $60.5 billion in 2013. It did drop to $59.8 billion in 2015, though that is still a great deal of money. Let's talk about how this profit works. A person goes on a diet and loses weight. According to Tracy Mann, a social psychologist, an individual's hormones go wonky at this point. The levels of hormones that help you feel full decrease. The levels of hormones that help you feel hungry increase, says Mann, leading to weight gain. Hirschman and Munter say that this person then experiences guilt and starts the process all over again. Mann argues that each time this happens, the person is likely to gain weight in the process, ending up fatter than they started. W.C. Miller found that even when a person maintains the weight loss behaviors, the weight is likely to come back on. It's important to note that a person in the obese category has a less than 1% chance of ever seeing normal weight, Fieldes et al. Found. In fact, there is no scientific evidence that long-term weight loss is achievable for the majority of people. What we do have is evidence that fat is primarily genetic and is controlled by quite complicated factors. Despite all the hoopla about how obesity will kill you early, it doesn't. In fact, overweight people actually tend to live the longest, with normal weight and obese coming in about the same, according to multiple large population studies, including studies done in the US, Canada, and in Japan. What an awesome product! The disease doesn't kill you, the product fails 99% of the time, People buy the product again and again, crediting the pill or weight loss program with any success and blaming themselves for any failure. This cycle leads the fat individual to experience a Sisyphean imperative or bind, which is a demand that the individual succeed at an exhausting and futile task, one that must be performed over and over again before being considered worthy to receive what others are granted automatically. It creates a vicious cycle where the fat individual can never truly succeed in reaching acceptance. Many fat people spend their lives in this constant cycle of weight loss and weight gain. By the way, we know that weight cycling is very bad for your health, according to Mann. Part of the frustration with this situation is that fat bodies are not inherently unhealthy. We have already noted that overweight people live the longest. Habits matter whatever your size, as fat people who eat well and exercise are actually healthier than thin people who do not. Linda Bacon, a nutrition professor at the University of California, Davis, argues that eating better and exercising balances health indicators like blood pressure and blood sugar, even when these habits don't lead to weight loss, which they often do not. So then, why do we associate weight with being unhealthy? Since depression and some diseases, such as Cushing's disease or thyroid disease, can cause weight gain, we tend to associate fat with disease. We constantly hear how obesity causes type 2 diabetes, but research suggests weight gain is a symptom of diabetes rather than a cause, especially since thin individuals get diabetes as well. In fact, there is not a single disease that only fat people get, says Bacon. And when a fat individual is sick, they have to fight to get a diagnosis rather than a diet, to borrow a phrase from fat activist Marilyn Wan. My research has revealed person after person who went to a doctor only to be told to lose weight when they actually had diseases such as thyroid disease, multiple sclerosis, and cancer. Some of them had to fight for years to get treated, often getting treatment only after their disease had progressed significantly. How does all of this healthism affect fat people? Fat people are perceived as inferior by society. They are less likely to get a job or promotion. When employed, they are employed at lower salaries. We've already talked about their lack of access to health care. Individuals who deal with prejudice can have a situation called minority stress, which is the relationship between minority and dominant values and resulting conflict with the social environment experienced by minority group members, according to Michael Dentanto. It is often caused by all the little issues that marginalized people must negotiate every day, leading to a form of complex PTSD called race-based PTSD. All of this can lower a fat person's esteem. Notably, this constant prejudice also leads to poor health outcomes. On some level, as a society, we know we treat fat people poorly. How many of you are terrified of ever becoming fat? So what can you do about this situation? What you can do is help alleviate healthism. You can start out by realizing you cannot tell anyone's health by their looks. As Marilyn Wan says, the only thing anyone can diagnose by looking at a fat person is their own level of prejudice towards fat people. In fact, we need to quit judging others' health. We need to quit seeing someone as inferior because of anything to do with their health. It would be nice if we even take that a step further and note it's a good thing to quit seeing people as inferior in all areas. You can think about the rhetoric you are hearing, especially if a particular group is being vilified. Ask yourself, who profits from this situation? That one question can often reveal powerful motives behind situations. Finally, you can learn more about weight prejudice so you can be more aware of how it affects everyone. Because if you are not fat, you may well fear becoming fat. If you are fat, you may experience size prejudice in society and in medicine. Your best defense is to become educated about how that prejudice works. To wrap this up, healthism has been used to vilify fat people as a replacement for other prejudices, as an excuse for rising medical costs, and as a way to make profit. Society and the medical field do not have to work this way, and you can do your part to alleviate that situation. This has been a Fat Studies presentation. Fat studies is a relatively new field that crosses disciplines, focusing on the experiences of fat individuals and the interaction of fat and society. If you are interested in health and fat, I encourage you to start with Linda Bacon's book, Health at Every Size, Tracy Mann's Lessons from the Eating Lab, or my own book, Talking Fat. Feel free to email me at lonnie.mcmichael@gmail.com with questions. I will be unavailable April 20th through 24th, but will get back to you as soon as I can.